Welcome, Dr. Shetty, to Editor Speak. Can a postgraduate student perform an intervention without the supervision of a senior surgeon?
A postgraduate student is still a student, so it is always advisable for him to perform any intervention under the supervision of a senior consultant or surgeon.
So, if I understand, a postgraduate student can perform minor surgeries without the supervision of a senior consultant, but not major surgeries. And what about emergencies?
First and the foremost, human body may not respond the same way every time. Is the student capable of handling such emergencies? So it's always advisable, even for a minor surgery, to be done under the supervision of a senior surgeon. As far as emergencies goes, there are no protocols. Whatever is done in the best interest of saving the patient's life, there need not be any protocols. A student can go beyond his area of expertise also and perform an intervention to save the patient's life.
So, if a PG student performs an intervention without the supervision of a senior surgeon, who would be held liable? The PG student, the senior consultant, the hospital, or all three of them?
See, a student is a student. If he performs a intervention without the supervision of a consultant, the consultant and the student will both be held liable. More so the hospital for not have protocols in place where who should perform the intervention should be decided in advance. Recently there was a judgment from the National Consumer Commission wherein a patient of non-Hodgkin's lymphoma, stage 4, metastasized to the spine, because of which he has developed a neuropathic bladder. After 2 cycles of chemotherapy, the patient developed urinary infection. There was a Foley's in place. They found it difficult to remove the Foley's. The patient was referred to the surgical ward, where a postgraduate student decided to do a suprapubic cystostomy because he could not remove the Foley's. He performed the intervention. The patient was sent home. After a few days, the patient came back. He was diagnosed with a perforated bladder. The senior surgeon performed the intervention, corrected the perforated bladder. Patient put on ventilator. Patient recovered. But in the bargain, the patient missed out on his cycles of chemotherapy. And a few months later, the patient died. The relatives alleged that the PG student was not a fit person to perform a suprapubic cystotomy. The court perused medical records and the court held the PG student negligent. The court held the senior consultant negligent and the court held the hospital also negligent. The court said a patient of non-Hodgkin's lymphoma with a neuropathic bladder was a complicated surgery. He was prone for a complication. At such time, it was invariably the senior consultant had to be around, and not doing so was negligence. And the court held the hospital negligent because they had not put protocols in place in a teaching hospital where a postgraduate student was not supervised but a senior surgeon. So all three were liable.
So, what I understand, a PG student will be held liable along with the senior consultant if he was not under the supervision of the consultant.
He will have to be. He is a student. He is on his learning curve. In a learning curve, somebody has to supervise the student. It has to be the senior consultant. And if there are no protocols, the hospital will definitely be held liable. This hospital was a teaching hospital. So protocols should have been in place. So they will definitely be held liable.
So, Dr. Shetty, what will be your key take-home message?
See, the students, medical students of today are doctors of tomorrow. They are on a learning curve. They have to learn on living patients. So you have to accept the fact that there is going to be a living patient who will be handled by the student, the postgraduate student. But at all times, the standard of care should not be allowed to suffer. the standard of care has to be the highest standard possible. And this can only be possible if it is supervised by a senior consultant or a surgeon. Always remember, the exuberance of youth should be tempered by the experience of the senior surgeon. And hospitals have to maintain protocols where the standard of care remains the highest.
Thank you, Dr. Shetty,
Thank
for
you.
your invaluable inputs.
Thank you.